Pain can sometimes be a natural process with running and adapting to running. Fortunately, it is something that can be addressed with physical therapy. We can expect to see results, whether it's reduction in pain or an overall improvement in running distance and tolerance.
I recently got back into running, and then I started getting slight hip pain, and then it didn't stop for 7 months. The anxiety of not knowing how far to push myself, when this will get better, how I'm going to get better, really negatively impacted my life.
Debilitating pain can be a scary thing. It could prevent you from enjoying the activities that are a big part of your life, and it can make you lose a sense of identity. Debilitating pain with running is very common, but it is very treatable.
It's really hard when you're used to feeling strong and in shape, and then that's taken away from you.
Running is a very repetitive and impactful function, and if the muscles are not trained and conditioned to accommodate that kind of exertion, in turn it can lead to certain pains, not just in the muscles, but also the tendons that anchor to the joints, which are also worked with running.
When I was injured, I wasn't able to sleep on my left side. I wasn't able to even walk maybe a half a mile or more without any sort of pain.
When evaluating a runner, we zone in on things like range of motion, strength, balance, agility, and their running form as well. The most common treatment options we use typically is a solid strengthening program. Strengthening includes conditioning the tendons and joints to endure long periods of impact and repetitive motions. If a person is running and they're experiencing pain or injuries, it might be necessary at first to tone down the overall amount of running per week to a level that they're tolerating well, and then week by week slowly increasing that as tolerated.
The physical therapist is really good about being like, listen, you still need to take it easy. We talked about how I should start running again. I need to go slowly. I need to do more days for less time rather than jumping back into it, which was really helpful for me.
Rest is very underrated. Many patients whom we work with sometimes are not getting sufficient rest if they are running multiple times a week. Usually if it's the lack of hours of sufficient sleep each night, or if they're not taking enough days off in between the running sessions, that can put them at more risk for injury. When you're trying to start running for the first time and you jump straight into it, you might not be properly warmed up, as in the muscles aren't having the proper circulation or your joints aren't as loosened up. Something around the quick 5-minute is usually sufficient.
I do a walking warm-up, I stop, I stretch, I do another walking warm-up, and then I'll go into the actual run, and then I do a cool down stretching. I've had such good results. So it's just kind of a mindset change.
Patients can certainly involve themselves more with running by being proactive in their overall health and wellness, ensuring that they are taking the right approach with running, giving their bodies time to rest, fueling their bodies properly with the right kinds of foods, and also trying not to rush the process.
So now I'm able to run 4 days a week, and I'm weightlifting 3 days a week, and just living my life without pain. My sleep is so much better. Being able to sleep well just cascades into the rest of my life. When you walk in and people are so kind, people that do the scheduling, the physical therapists themselves, all the assistants, they are so welcoming and kind and thorough. It felt very genuine that they want to make sure that you're doing what you need to do.
For patients who are suffering from very severe debilitating pain with running and are unable to do the activities that they enjoy on a day-to-day basis, we take into consideration many factors in people's lives and tailor the treatments towards their personal values to ensure that they can improve week by week and eventually reach the level that they're looking for.